delighted to be here coming live from Lisbon for EACTS 2024. I'm here with colleagues who are telling us about an exciting session that will happen tomorrow on aortic disease. I'd like to start with Ms. Catherine Fowler. She's involved with an aortic trust, and I want to hear more about what you're doing and what you'll be telling us tomorrow.
Yeah, sure. Thanks, Jill. So myself, Bob, Graham Cooper, and Pauline Latham founded a charity back in 2021. So we're quite a young charity, and it's all about uniting a community of people who have lived experience of aortic dissection, whether you're living with dissection or you have lost someone to aortic dissection, or in fact if you've dedicated your whole career to aortic dissection too. So we work around shaping a safer future for people who are impacted by this condition, and we focus in three strategic areas: so education, policy change, and research, importantly for the future. But we're here in Lisbon delighted to share a project that we're extremely proud of. We're about to launch it as a proof of concept later this year, and it's about funding aortic nurses. So we know how important it is for patients to have effective follow-up from a physical perspective, from a psychological perspective, and equally as the condition runs in families and it can be genetic, the opportunity for that genetic screening and follow-up to really get ahead of this condition and stop people being impacted by it in the acute setting. So it's a real gap here in the UK. I think there's opportunities. You know, this is an international conference for us to learn from each other as well. So we're delighted to come and share our project, where we're going to take it, and equally we've been working very closely with a charity here in the UK called Macmillan. They've been funding cancer nurses for 100 years now, and they have been a fantastic charity to hold our hand and support us to make a difference for patients and families who are impacted by this condition. So yeah.
I'm delighted to hear that you're getting the support that you need. You're here with a patient who has what I think is a story that we can all learn from, and I'd be delighted, Bob, if you could tell us a little bit more about what it's like from your perspective.
Well, I suffered a dissection at the end of May 2019, and honestly, it was by far the most threatening and traumatic experience of my entire life. I know that I'm very blessed to still be here, having come through it, and I wasn't operating on. I continue to be what's called medically managed.
Yes.
But as I began to recover from the experience, and I was in the hospital for 10 days, 2 weeks, and when I got home, once I left the environment of the hospital, I felt very alone. I couldn't find anyone to talk to. I couldn't find anyone to sort of touch down with and just exchange ideas and get reassurance. And I became very frightened about even the idea of going up and downstairs.
Oh,
in
goodness.
case this would happen to me again.
Yeah.
I mean, it sounds strange to say this, but thankfully, I'm also being treated for prostate cancer. It's not to say the word thankfully in that, but I've been living with prostate cancer from 2007 to the present day. So I have an oncologist with whom I have a very close and really good relationship. So when I was well enough to start going back to the oncology clinic, which in itself at the time was a massive challenge, getting up, going out, going back to the clinic, I was able to sit and talk to him, and through the other aspects of my cancer treatment, scans, exams, we were able to keep on the track of my progress out of my aortic dissection experience. He was giving me the patient aftercare that I couldn't find from my own condition. So when Catherine and I started talking, because I was reaching out, trying to find people to talk to, I went onto one or two forums. I don't recommend forums at all. they are so frightening, you know. And it wasn't until Catherine and I began to speak with them, I realised that Graham and Pauline were also part of this new Aortic Dissection Charitable Trust. And suddenly I felt there was a team. I wanted to contribute, to just offer my own, you know, story of my own experience, and be there to support them and them support me in terms of establishing the charity and what we're trying to do. And one of my own personal, as you can tell, special subject within this is patient aftercare, and we're making great progress. I'm so proud of the fact that we've become kind of sort of power quartet.
I'm so excited to hear this story, and we all can learn so much from each other, and aftercare is a huge gap in many of our medical systems, certainly in the United States. Graham, we're delighted to have you here today as well. And can you tell us about your role and how we're all learning from you today?
So I'm a cardiac surgeon by background. For my professional career, I've operated on the thoracic aorta. A trustee of the Aortic Dissection Charitable Trust. Delighted to be here in Lisbon, of course. And really my role today and tomorrow is just supporting Bob and Catherine, who are doing all the heavy lifting. But I think certainly in the UK, we know for certain that follow-up of patients after aortic dissection is very, very patchy. But it is critically important that they do get properly followed up to prevent further problems down the line. And that follow-up needs to encompass not just the physical issues about having scans, how much exercise they can do. We know about a third of patients who have an aortic dissection have post-traumatic stress disorder. I think Bob's described a little bit about that. We think this concept of having an aortic nurse to support these patients through their follow-up journey is going to be a really positive step to improving not only quality of life, but the length of life and outcomes for this important cohort of patients. So that we're really proud to be here talking about that.
You're talking about tremendous opportunities for nurses. As a nurse myself, I can't help but believe that nurses are the glue that keep a lot of these projects together, along with funding and good people that are willing to really go to bat for it. So I thank you all for the work that you're doing. Would you like to leave us with any final messages about what we can do to support you?
Well, I think as a patient, I will say that one of the most important challenges to overcome is what's happening in your, the psychological impact. There's a huge physical impact of a dissection, as we know, but the psychological impact is invisible but huge. Graham just touched on it there with post-traumatic stress disorder, which I know at moments in flashpoints I still suffer from. So that patient aftercare, I think it's a vitally important part of recovery long term and support long term. So this is, one of the big things that we're working towards.
Definitely, and from my perspective, I think we all love a guideline, don't we? And we know that guidelines and standards are really lacking in this area. It's something that we've been lobbying government and our Secretary of State for Health and the Department of Health to make change in this area, and there's really good progress happening. So I think it's a combination of setting really good standards and guidelines that we can learn internationally from each other. And you're absolutely right, the role of the aortic nurse for these guidelines will absolutely take that policy from the page to the patient, and that's what really matters. So there's a fantastic opportunity for us to come together, to share experiences. I have to do a little shout out for our friends in the States, the John Ritter Foundation. We collaborate with them, and they've been huge supporters for us as a charity. And for me personally, when I was going through my dark times and losing my dad, they were really there for me. So I think collaborating with each other, patients, medical professionals, nationally and internationally, and going across discipline, I think that's where together we're going to be stronger and make a real difference.
Thank you all so much. This is an incredible opportunity internationally for our healthcare community, and you've inspired us to do better. So thank you so much for being here. I look forward to your session tomorrow. And thank you all. Join us next year. Bye-bye.